What was residency in psychiatry like? Peter Goertz, I'm a psychiatrist. My own residency was quite some time ago. And at this point, I've been supervising residents in psychiatry, so I still have some idea what residency is like. My residency at NYU was overall great. I really enjoyed it. I had a lot of exposure. I was privileged to have a lot of exposure. We had a city hospital, a university hospital, a state hospital, the VA, and other hospitals. And in my opinion, the patients are the main teachers for us. So the variety of settings really gave me a lot of exposure to various patients from different walks of life. And that was wonderful. That was a wonderful basis for being a psychiatrist. I started residency as a second-year resident in psychiatry. I'd done an internship at LSU, and I'd done internal medicine, pediatrics, surgery, OBGYN, so those rotations during the internship. And I'd spent a total of almost 3 months in various emergency rooms, the medical emergency room, surgical emergency room, pediatric emergency room. And when I started residency at NYU, administratively, there was some chaos, and the residents actually were not getting paid. And I remember a conference or a meeting we had, a third-year resident at the time was in a major way helping run the program because of the chaos that was going on. And he was telling us that we weren't going to get paid. And one of the interns got quite upset, I remember, during that meeting. He wasn't expecting that he wasn't going to get paid, but it worked out fine, actually. We took out loans from NYU for a while, but then the situation resolved and we got paid again. There was a lot of independence, and at the same time, we could get help if we needed it. And for me, that was great. I find that I learn better if I'm not hovered over, or if someone is not really constantly checking on me. So for me, that worked out well. And again, we could call or get help if we needed it. And when we were on call, the decisions were basically ours unless we weren't sure and needed to call someone, so we could decide on our own whether or not to admit a patient, for example. In the outpatient clinics, we had a psychopharmacology supervisor, a psychotherapy supervisor, and we met with the supervisors periodically. The supervisors did not actually see our patients, though, and we did not discuss every patient, far from it. We discussed maybe, I don't know, a small percentage of the patients we saw, and we picked which ones we wanted to discuss or had questions about. And the rest we worked on our own. But again, if we had questions, we could always call someone. The didactics back then were varied. I enjoyed them. We had good teachers from psychopharmacology to psychoanalytic psychotherapy, child psychiatry. I enjoyed neurology. We had a 2-month rotation. And I also did neurology as an elective then in my 4th year of residency, and the teachers were good also. I enjoyed neurology. And I would recommend both psychiatry and neurology, that throughout residency you study steadily and really just use your time concurrently with your rotations to study, and that'll make things easier then for the board exam. At the same time, I think starting in 2nd year of residency, we were allowed to moonlight in the city hospital, in the ER, or on the wards. I did both. At some point, I think, or one of the rotations, the moonlighting opportunities was just to do physicals in the emergency room. I did that for a little bit. So various things that were quite interesting. And at this point, I've been supervising residents here in New Orleans now, and times have changed somewhat. There seem to be maybe more regulations or stricter regulations. So when the residents in our clinic see new patients, I do have to see them. So at least briefly, I need to walk in, talk with the patient, the resident presents what's going on, and I talk with the patient. And also when the residents are on call at night, they do not just make decisions on their own. They do call the attending psychiatrists and discuss each emergency room patient with the psychiatrist. Thank you.